I'm part of the co-organizing team of this event. And in this closing day of the first Global Infodemiology Conference, I would like to give some reflection about the organization of the conference and what we collectively achieved. First of all, I really would like to warmly thank the co-organizing team. So Sylvie, Tim, Tina, Liz, and Stefano. But to put together this big event, as Sarah mentioned, we really relied on an expanded organizing team. So I would like also to thank the fellows at US CDC, the EpiWin team in WHO, and I'm sure I'm missing many people, but thank you to everyone who contributed. The conference has been organized in less than a month, and it was a great collaborative effort between WHO and partners to ensure that everything was ready to allow fruitful discussions, to prepare all background documents, and to ensure that the conference ran smoothly. We had 2 fantastic chairs, Neville and Viroge, as well as a total of 10 amazing keynote speakers during the pre-conference and the closed scientific conference. We had 8 great topic masters, 8 very motivated and dedicated topic assistants, as well as 4 amazing coaches. So just to give you an idea of the scope of the preparatory work that was needed to organize this conference, just for the closed scientific conference, we had more than 49 organizers and speakers involved. So it was really a big machinery to make this happen. I would also like to thank all the participants for their time and their involvement in the conference. We know it's not easy to dedicate many hours of your time during busy crisis period, and especially at short notice. I think this really demonstrates that there is a great interest currently in this field, and that we need to build on this momentum to advance the science and to be better equipped to tackle infodemics. So the format of the conference was quite original and successful. We had a pre-conference open to the public with 7 amazing keynotes that really set the scene. We had more than 11,000 people connected online from various regions in the world. We had people coming from academia, from the healthcare sector, from international organizations, from public health authorities, from NGOs, from the private sectors, from civil society, as well as from the media. So very diverse expertise represented. Then we had the closed scientific conference that gathered more than 110 experts around the world. We had 20 disciplines represented across 19 time zones. So it was quite a nightmare for the organizing team to schedule all the meetings, but we had a very dedicated experts who joined us for the discussion even during night hours. We had an opening day with keynote speeches, and then we had an intensive closed working session called the sprints. And experts were grouped in 4 teams, and they were discussing 4 topics over 2 weeks. We had a total of 16 sprints for a total of 32 hours. And if you combine the work of all the experts who participated, it represents about 3,000 hours of work. So it's quite amazing. And the sprints discussion were brilliantly driven by our topic masters. So around 4 topics. The first one was, how can the digital physical information environment be measured and monitored? The second one, how does the information originate and spread? Third one, how does information affect and impact individuals and population? And the last one, what intervention work to protect and mitigate? So about 86% of the participants say that they think WHO should run conferences similarly in the future. And I tend to agree. I think it was a really productive way to conduct meetings. The sprints lasted for 2 hours twice a week, and people were very engaged in the discussion. Probably more if they were in a meeting all day. They had time to, between the sprint, to look at the background documents and to prepare for the discussion. And we also had electronic tools that enabled us to conduct surveys and to share experience and research work in real time. So it was a really, really interactive meeting, probably much more than traditional ones. I just would like to highlight a few outcomes of this conference. So first, we are really defining together the field of infodemiology, the science behind managing infodemics. So this starts with defining and agreeing on a common vocabulary. And here my colleague Stefano will talk more about the glossary in a few minutes. We are also building a community of practice and a community of research together. And I was a topic assistant during the conference, and it was really great to see people from the very different fields coming together to work on some topics, trying to understand one another and sharing their knowledge and experience. Many participants reported that they made connection with other participants outside of the meeting. So there was, and there is still, a great appetite in continuing this enriching collaboration in the future. And my colleague Liz from US CDC will talk more about how we will continue to collaborate on this in the future. We also have started to build a public health research agenda to direct focus and investment in this emerging scientific field. It is articulated around 5 streams. So how to measure and monitor the impact of infodemics during health emergencies, how to detect and understand the spread and impact of infodemics, how to respond and deploy information that protects and mitigates the infodemic and its harmful effects, how to evaluate infodemic intervention and strengthen the resilience of individuals and communities to infodemics, how to promote the development, adaptation, and application of tools for the management of infodemics. And here, again, my colleague Liz will talk more about the research agenda. So lastly, I would just like to mention that we have a lot of material published on the WHO website about this conference, about infodemiology, and about infodemic management. We have videos, we have the booklet of the conference, and we have some drawings, and soon the report of this conference will also be available. So I'm sure we have shared with you the link, or it will be shared very shortly. So thank you again to all, and over to you, Sarah.